It's time for our health segment, and joining us now is Africa 54 health correspondent Lino Mudu with some very good news concerning malaria. Lino?
That's right, Esther. Get this. Algeria and Argentina have been officially recognized by the World Health Organization as being malaria-free. The certification is granted when a country proves that it has interrupted indigenous transmission of the disease for at least 3 consecutive years. Algeria is the second country in the WHO's Africa region to be officially recognized as malaria-free after Mauritius. The North African country reported its last cases of malaria in 2013. Argentina is the second country in the WHO's region of the Americas to be certified in 45 years and reported its last cases of malaria in 2010. Over the last decade, improved surveillance has allowed for every case of malaria to be rapidly identified and treated in both countries. The countries have also provided a free diagnosis and treatment within their borders. Contracted through the bite of an infected mosquito, malaria remains one of the world's leading killers. Over 400,000 people died from the disease in 2017. Most victims are children in Africa under age 5.
And the country has done this through consistent application of the tools for malaria prevention and control, through good surveillance, through good investment, and also through having established a primary health care system that has gone a long way towards universal health coverage. This will encourage and I'm certain inspire the rest of the continent because we know that there is much still to be done in the African continent and in the region to get on top of the malaria program.
These are the efforts that we've made since independence 1962. They are based on efforts by health professionals who have integrated and adhered to the recommendations from the World Health Organization.
And the malaria-free certificates were presented recently by the WHO Director General to representatives from Algeria and Argentina. Now, the first ever malaria vaccine is being rolled out in Malawi, as we reported in the past, after 30 years of development by GlaxoSmithKline. The development of the vaccine cost almost $1 billion, and it's the most advanced vaccine yet to fight the mosquito-borne disease. Gavi, the Vaccine Alliance, has been involved in financing the malaria vaccine rollout, and the World Health Organization has taken a scientific and technical leadership role. 4 successive doses must be administered on a strict timetable for the medicine to work. Meanwhile, everyone must also continue to use other preventive measures, such as sleeping under a mosquito net.
For example, if we roll out this malaria vaccine after the pilot phase, this vaccine has a potential of preventing 1 million cases. And at the moment we experience 6 million cases each year.
We will do this pilot for the next 30 months, and we are intending to vaccinate 120,000 children per year. And afterwards, after 30 months, we may be rolling out to more districts and eventually probably the whole country.
The vaccine rollout campaign aims to immunize 360,000 children aged 2 years and under in Malawi, Ghana, and Kenya to assess the effectiveness of the pilot vaccine and whether the delivery process is feasible. Health experts say great progress is being made in the global fight against malaria. However, the number of malaria cases is still rising in some parts of sub-Saharan Africa. Megan Christensen, health advisor for Concern Worldwide US, reveals some of the reasons.
Weather patterns are changing, and we're seeing climate shocks that are starting to change transmission zones. So in areas that previously did not have malaria or were non-endemic, we are starting to see conditions in the environment ripen for potential transmission. And when these climate shocks happen, or climate or weather events happen, people are very vulnerable. If you're displaced from your home and you're sleeping outside, we know that the malaria mosquito bites between dusk and dawn. And so people are very susceptible to illness during that time. Part of this is because of vulnerability, whether that's displacement, whether that's conflict. And we're still fighting these challenges that have always been there with weak health systems and populations that don't have sufficient access to quality care. So there's an opportunity cost in seeking care where if you're a caregiver and you have to decide either my family eats today or I take this child to a health facility, which is the reality for many of our beneficiaries on the ground, you may choose to delay seeking care for those very reasons that you either have work to attend to and you're not able to actually forego that experience. And so I think, we're still fighting some of those age-old challenges of how do we actually get access closer to the community? How do we reach the last mile?
And that's our health report for today. To stay in touch, find me on Twitter @LenorMoudou. Esther?
Very great coverage on malaria today, Lino. Thank you.
Thank you.
All right. Be sure to watch Lino Moudou's health reports every Tuesday and Thursday right here on Africa 54. And that's our show for today. Watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a good evening.